Hi, my name is Kiera Brown. I'm one of the chartered physios at Total Physio in the Slievemore clinic. Here at Total Physio, all of our Pilates instructors are experienced chartered physiotherapists with specialised training. During pregnancy and delivery, our body faces many changes. Our bodies adapt to these changes, however, those adaptations might not always be ideal and can lead to both short and long-term problems. The key areas we focus on are posture and balance, relaxation and breathing, abdominal and pelvic floor support, and specific exercises for any of those niggles as they arise. Alright, now we're just going to introduce some Pilates exercise to help treat or prevent any of those niggly injuries. So you just need a flat place to lie down, maybe a little mat or a towel, and a little cushion underneath your head or a folded up towel. And switch off the mobile phones. Breath in, floating the hands up to the ceiling, and breathing out, hands overhead towards the floor without allowing the ribs to flare up. Breath in, hands up to the ceiling, and breathing out down by your side. Breath in, hands up to the ceiling. Breathing out, hands overhead towards the floor, keeping the ribs down. Breath in, hands up, and breathing out, bring the hands down. Next exercise, hands a little off to the side, palms facing up to the ceiling, bringing both knees and feet together. Breath in, and on breathing out, bringing both knees off to one side, turning the head the opposite direction, hand turning down, breath in, and on breathing out, coming back with the ribs first, then the hips and the knees, head returning and palms up. Breath in, and breathing out, dropping the knees off to the opposite side, head look away, the hand you're looking at turning down, breath in, and on breathing out, coming back with the ribs first, then the hips, and then the knees. Hands facing up. The next little exercise, a little cushion in between your knees, and pop a little support from underneath your head. Breath in to prepare. And on breathing out, tucking tailbone under, peeling spine away by lengthening the knees away. Breath in, hold. And on breathing out, using the out breath to send your ribs down first, lowering through your lower back and tailbone down. For this next exercise, you're going to need a bigger pillow underneath your head just to hold your head in neutral. Knees directly in front of the hips, hands out in front. Breath in, hands up to the ceiling, top hand up to the ceiling, and coming around, following the movement with your eyes, and breathing out to close. Breath in, hand up, bending the elbow, following the movement with your eyes, and breathing out to close. And then you can repeat that exercise on the opposite side. Okay, so now the next exercise we're going to do is one to strengthen in around the hip muscles and around the waist. Lengthening the top leg away in line with the hip joint, bring your toes towards you, sending the heel away. And from here, just raising a little bit up and gently lowering down. And again, and lowering down. Another version of the exercise is bring the leg in front at hip height, gently point the toe, and gentle little circles around a tennis ball. Again, this is going to strengthen the muscles in around the hip and the outside of the leg. Alright, thank you. Okay, now this is a lovely little exercise to strengthen the muscles in and around the shoulder blade and open up the lower back. So just when you're ready, breath in, tucking your tailbone under, opening up through the spine, allowing the head to hang down, breath in, and breathing out, sending the tail in the air. Coming up. Breath in, tucking tailbone under, opening up, lovely, allowing the head to hang down, and then breathing out, sending the tail in the air, unraveling the spine segment by segment, and relax. Okay, another exercise then would be a Superman, so sending one hand away along the floor and opposite leg away, keeping the hand and leg on the floor in later stages of pregnancy, and then returning, and breathing out, sending opposite hand and leg away, keeping the pelvis and the shoulder blades nice and steady, and return. Breathing out to lengthen opposite hand and leg away, and breath in to return. Okay, so this next little exercise is sitting in the Swiss ball. You want to have a nice upright posture as if you're lengthening up through the top of your head, your shoulder blades nicely back, and your shoulders above your hip bones. And from here, just a little tilting, just rolling the ball side to side, a little bit of pelvic rotation, and then little pelvic circles. So you're rolling the ball in a little circle. It's a nice little one to get the pelvis gently moving, and then reversing the little circles and relax. Okay, and then the next little exercise is just breath in, and then breathing out, floating the hands up behind your head, Breath in, shrug the shoulders up. Breathing out, sliding the shoulder blades down. Breath in, hands up. And I'm breathing out, floating the hands down. And again, breath in. I'm breathing out, floating the hands up behind your head. Breath in, shrug the shoulders up to your ears. Breathing out, sliding the shoulders down. Breath in, hands coming out. And floating the hands down. And that's a beautiful exercise for setting the shoulder blades, particularly if your shoulders are becoming a little bit round. All right, thank you.